it is what actually will make it possible for us to end TB by 2030.
Thank you very much. Coming from the country with the highest burden of TB, I want to thank you for all the investment, especially in the community and the community interventions. Thank you so much. I'll now call upon Honorable Vice Minister for Health and Environment Surveillance, Brazil, Dr. Etel Leonor Noia Marcial. Brazil has recently demonstrated impressive progress in translating commitments to bold action, especially through multisectoral engagement. If you could please highlight how the shared responsibility of resources across sectors has helped tackle the core drivers of TB, including advancing TB research and development. Thank you.
Thank you. It's an honor to be here today. Thank you very much. First of all, I'd like to congratulate Dr. Tedros for the incredible work that he is doing, and acknowledge Dr. Teresa Casaeva for the leadership in the tuberculosis field. As we all know, Brazil is a high TB burden, but unfortunately, the high TB burden in Brazil was not the same for all population. We have vulnerable population that in Brazil are suffering a lot. As Dr. Atul said, in the last 3 years, we all suffer, but we are not suffer in the same way. And it's very different for country to country and inside country for some populations. In Brazil, unfortunately, because of the increase of poverty, we are arriving in the United Nations high-level meeting worse than we were in 2018. We will arrive at the same rate that we were in 2002. So it's a terrible indicator that we have in Brazil right now. So because of that, the President Lula make a decree obligate the 9 ministers work together to eliminate TB and other social determinant disease as leprosy and others. But TB is a high priority in our country right now. And we are very familiar working in a network with a lot of countries, but what we are seeing right now is that we are failure as an entity, as a country, as a network in the world, because right now we are failure to deliver the tools that we have already for our population and for other population in other countries. For example, the multi-drug resistant medicine, they are not available in all country, and most of them because of the high prices of this medication. So we need to give to the WHO, and our government right now is very much aligned with the WHO, and we have to give to WHO the leadership to guide us in this new route, to have not a bilateral negotiation, but a multilateral negotiation. And we have to learn with our mistake with the COVAX facility initiative. And we have to have right now one health structure, some like that, but we can give to our Dr. Tedros and his team the right elements or structure to work with us as a country to have for fair and affordable price for all new progress and innovation that we will have. Because right now we are failing in this. We are not doing our job. We don't have the new diagnoses that are in place in rich country, in a lot of countries. And this is a shame for all of us sitting in this room, that we are working so hard to say that we are NTB in 2030, but we are doing very little. So in Brazil, we are right now with this new government that we make part, work together with this multi-sector approach to work with this most vulnerable population, and especially for the indigenous peoples that we invite other countries to this new regulation that we are bringing for the World Health Assembly with other countries to propose this regulation for the indigenous peoples, because in Brazil, tuberculosis is a major killer in this population. And in all over the country that has traditional peoples or indigenous peoples, we left them behind for so long. So right now, we need to look for this population. We need to do our job for the vulnerable population in all country, because even in rich country, we have this vulnerable population that we need to put in the center of our job, in the center of what we are doing for tuberculosis right now. So I saw that my time is running, and I would like to thank you very much and say that, as our president are saying in all of the place, Brazil is back, and Brazil is open to work together to NTB with the WHO in the leader of this process. Thank you very much.
Thank you so much, Honorable Vice Minister. Really humbling to hear you actually say that we have failed, because we can only go higher from there when we recognize that there is so much to be done. So thank you for that urgency, and wish you the very best. We'll now move to Honorable Deputy Minister for Health Technology, Indonesia, Mr. Setiaji. And Indonesia's domestic investment in health is really essential for a sustainable TB response to advanced research and innovation. Could you please share with us the new innovating national health financing strategy and its impact on equitable TB service coverage, and addressing the catastrophic health spending and countries' commitment to advanced TB research, especially with the new vaccine development? Over to you.
Okay, thank you. Good afternoon. Ladies and gentlemen, distinguished delegates, it's a great honor for me to address this esteemed discussion at the 76th World Health Assembly. Yeah, as we know, tuberculosis to be a global health crisis that demands our urgent attention. It's not only a process of significant threat to public health, but also undermines social and economic development in countries around the world. Yeah, to tackle this formidable challenge, we must achieve what we call this universal health coverage for TB care by prioritizing domestic financing, strengthening, also promoting country ownership, and ensuring accountability at all levels. Firstly, strengthening domestic financing is crucial to sustain and scale up of our efforts in the fight against tuberculosis. As governments, we have a responsibility to prioritize tuberculosis in our national health budgets, ensuring adequate resources are allocated to prevention, diagnosis, treatment, and research. The inclusion of a parliament is crucial to ensure that the health agenda is being prioritized. Secondly, country ownership is fundamental to the success of tuberculosis control programs. Governments must take the lead in formulating and implementing comprehensive strategies that are tailored to their country's context. This requires strengthening the health system, building capacity like vaccine manufacturers, and fostering multi-sectoral collaboration. Significant investment in health over the past 2 decades have yielded striking progress in the fight against AIDS, tuberculosis, and malaria. Much of that has come through domestic resource, mobilization, and traditional development assistance. Country ownership combined with strong and mutual collaboration with multi-stakeholders will enable us to go a long way. Through this approach, Indonesia detected 700,000 new TB cases in 2022. Actually, this is the highest number since TB became one of the national priorities. Strong detection is the first step to appropriately treating TB patients, like we did in COVID, and a crucial part of breaking the chain of infection. Lastly, accountability is a cornerstone of effective tuberculosis control. We must establish a robust monitoring and evaluation system that track the progress. We also align with our program to integrate all the health facility. We call this Satu Sehat. So we will integrate all the health facility data, national medical record, into this program. So it can be easy for us to monitor and detect the new cases and also for tracing. And then the other side is how we can identify gaps and hold ourselves accountable for our commitments. This includes transparent reporting, regular data analysis, and the involvement of civil society organizations and affected communities. We also now to make some innovation or initiative to combine with the biotechnology system. We have an initiative, we call this BGSI, Biogenomic Scientific Innovation. We hope with this combined, we can get like precise medicine for the TB cases. By fostering a culture accountability, we can identify and address challenges promptly, ensuring that resources are utilized efficiently and results are achieved. Ladies and gentlemen, strengthening domestic financing, country ownership, and accountability in the fight against tuberculosis requires collaborative efforts and partnership at the global, regional, and national level. We must leverage existing platforms such as the Global Fund to fight AIDS, tuberculosis, and malaria, and engage with the private sector, philanthropic organizations, and other stakeholders. Together, we can mobilize the necessary resources, empower communities, and create an environment conducive to sustain progress. Accountability for health is not burden, but a responsibility we embrace to ensure the efficient and effective use of resources and delivery of a quality care to all achieve universal health coverage. Thank you.
Thank you very much for that. And I'd also like to acknowledge the TB survivor networks that the government has been engaging with in the country, and really would like to wish you the very best in that. I'd like to now move to Ambassador Honorable Czech, Permanent Representative of Poland to UN Office in Geneva, and also the co-facilitator of UN High-Level Meeting on TB. This is an extremely crucial time for all of us, and especially for you, because it's a pivotal year to push the agenda of TB forward. And heads of state will come together to deliberate, to commit to accelerating efforts to end TB at the UN High-Level Meeting in 23 September. The prioritization of TB in the agenda of heads of state and other leaders is extremely crucial and will provide impetus to step up progress against this ancient pandemic. Poland and Uzbekistan have been appointed as co-facilitators for the UNHLM by the President of the UN General Assembly. Ambassador, as a co-facilitator of the UNHLM on TB, could you kindly share with us your perspective and the ongoing efforts and aspirations for the second UN high-level meeting on TB. Over to you.
Thank you very much, Madam Moderator. Dr. Tedros, Director General of the WHO, honorable ministers, vice ministers, directors, executive directors, excellencies, distinguished delegates. At the 2018 UN General Assembly meeting on tuberculosis, we agreed that TB was a national and global health threat of the highest priority. Signing a historical declaration that promised universal access, multisectoral responses, innovative tools, and accountability for progress against the pandemic. But despite ambitious commitments contained in the declaration, there is still much to be done, and there are many challenges in order to end tuberculosis in the world. That is why this year's political declaration that will be endorsed by the heads of states and governments in September will be critical to renew commitments, promote political visibility of key challenges in tuberculosis, and to mobilize funding and action in order to properly address them, both at domestic as well as at international level. We need to get the TB response back on track in order to reach TB targets and to save lives. We have already passed several milestones of our preparatory process leading to the high-level meeting of the fight against tuberculosis. The briefing that was co-organized with the World Health Organization in March gave us an opportunity to discuss the latest information on the status of the TB epidemic and response, progress made towards reaching targets outlined in the political declaration of the 2018 UN high-level meeting on TB, and its implications for the countries, so that we are well informed in the discussions leading up to the 2023 United Nations high-level meeting in September. Excellencies, in early April, the joint briefing of the co-facilitators on pandemic prevention, preparedness and response, universal health coverage and tuberculosis was conducted, and several as important platforms to discuss coordination among three health processes, links and synergies among them in order to promote coherent, integrated and action-oriented global health agendas. Multi-stakeholder hearing on TB that was conducted on May the 8th was critical regarding the input from civil society on their priorities and action required in order to accelerate efforts to fight tuberculosis. Without the engagement of the relevant partners and stakeholders, as well as populations and communities vulnerable to tuberculosis and people affected by tuberculosis, it is impossible to achieve the TB targets. All these meetings provided important input to the draft political declaration on the fight against TB that was presented on May the 15th at the United Nations in New York by the co-facilitators of the intergovernmental consultations on the outcome document of the high-level meeting on tuberculosis, permanent representatives of Poland and of Uzbekistan to the United Nations in New York. The draft that was presented has been developed on the basis of the resolutions of the General Assembly, authoritative and evidence-based studies and documents of the WHO and relevant international organizations, as well as thoroughly considered recommendations and proposals of all stakeholders, particularly those who participated in the multi-stakeholder hearing on May the 8th. Excellencies, this year is exceptional as we will have 3 consecutive health-related General Assembly high-level meetings in September. There are close links and synergies among the fight against TB, pandemic preparedness, and universal health coverage. With universal access to healthcare, almost everyone who develops TB can be successfully treated, and preventive treatment can be offered to those most at risk. Still, the latest data from WHO shows that access to TB treatment remains limited at 61%, and access to TB preventive treatment is even more constrained. Well-coordinated collaboration in these areas will contribute to the promotion of a coherent, integrated and action-oriented global health agenda. We hope that the incoming intergovernmental process leading to the high-level meeting will be critical to promote political visibility of key challenges in tuberculosis. We should all act together and increase our commitments in order to prove that we can reach SDG target 3.3 and end global tuberculosis pandemic by 2030. I thank you for your attention.
Thank you very much, Ambassador. We do look forward to a strong declaration which will give us much hope to end TB by 2030 for sure. Thank you very much. Now we come closer home, and I'd like to call on Dr. Luchika Ditu, Executive Director of Stop TB Partnership. Luchika, a human rights response is vital to ending the TB epidemic. And I know Stop TB Partnership has been strengthening advocacy, awareness, working with civil society. And, if you could share with us about these efforts that Stop TB has been involved in, and also what are some of the gaps that you see, and how can we strengthen community participation, boost investments and political will for a human rights-based TB response? Over to you.
Thank you, Blessy, Madam Chair. Thank you very much. Great to see this room full of people. I hope for this hour you are dropping, checking the emails and playing solitaire, because we discussed an important topic. I want first to start by thanking DG Tedros and Teresa. We had a meeting in late January, early February, in which we said we should try and have a WHA-TB event. There is big competition within WHO for the attention of DG, different diseases competing there. So we used all our charm. No, we used all our data to convince a person that doesn't need to be convinced, DG Tedros, to really give this opportunity to have a WHA roundtable on tuberculosis. My name is Luchika Ditu. I am a medical doctor, pulmonologist from Romania. I am the executive director of Stop TB Partnership, transformed from a medical doctor to an activist and advocate, very unleashed, and as Atul said yesterday, very frustrated on where we are with TB. And the frustration comes from the fact that for many years, we are trying to do a dent in this disease. But every time we are getting somewhere that we say from here we are going somewhere, we slip back. And in 2019, we were in a goodish place. We were not in a fantastic place, but was a positive place. And then COVID came and pushed us back. And you heard the minister from Brazil saying that the data of Brazil are now the ones of 2002. So Brazil lost 20 years of work. We say that very easy, but if we realize what that means, it scares the shit out of us, okay? Because that was hours of work and investments that went like this in 2 years of COVID. But there is something else that made us not to have a dent in TB, and that's the fact that, to be very honest, the attention span is very limited, and people and decision makers and stakeholders are running after shiny new things, forgetting the old things. TB is with us for hundreds of years, and we can end this disease. We cannot eradicate it in at least my lifetime. We cannot eliminate it, but we can end it by 2030. But we need to keep and stay focused, for God's sake, on some agenda topics. Because what we do is we run from one agenda to another, and there is something shinier coming up. We run for that and forget the rest. I met several ministers of health this week, amazing conversations. They all said, oh my God, everybody wants us to speak about PPPR, and that's the new shiny thing. TB is an airborne pandemic, okay? We need to write that, we need to tattoo it, we need to remember. It's an airborne pandemic. As a matter of fact, it was declared a global health emergency in the 1990s, and I don't think we ever closed that. So officially and formally, TB remains a global health emergency. And after it killed 1 billion people in the history, continues to kill every single day 4,400 people, including 700 children. Airborne. All of us here in the room, we can eat very healthy, we can exercise, we can avoid traffic accidents, snake bites. As long as we breathe, we are at risk of getting TB, drug-resistant TB, extremely drug-resistant TB, COVID, H1N1, and any other future airborne bug that is coming. When COVID came, as you heard already, it was the TB structure. There were the TB and nurses, doctors. There were the TB laboratories and hospitals. In most of the countries, not everywhere, that became the COVID doctors and nurses. I know for sure in Indonesia, our colleagues leading the TB shifted to COVID. Why in the world, I'm asking you all here, there is no mention once of TB in your discussions on PPPR? Maybe in the question and answer session, somebody will bring the light of that. Why we are not smart to look at how investments in TB helped us during COVID, that when we look for the future pandemic preparedness, we say, let's invest in things that will help TB, COVID, H1N1, SARS, whatever, flu, whatever bug that goes to nose, ends in the lungs, can be diagnosed with X-ray and rapid molecular, can be treated in the same hospitals with good infection control measures, by the same doctors that learn how to deal with the lungs and so on. Why we are, again, going into compartmentalizing things, and as the Honorable Ambassador of Poland here said, we are going into 3 back-to-back high-level meetings with 3 declarations in which, with the exception of the TB one, the UHC and PPR are oblivious to tuberculosis. We mention, and we have in the kiosks that we in Stop TB Partnership developed a specific section about UHC, PPPR, and the links with TB. As Stop TB Partnership, we are somewhere between we are a UN organization, but we are an activist organization, advocates. We roll out $250 million that we give as grants and goods in terms of drugs and diagnostics. We like to challenge the status quo and bring innovations from the Big South to the face of the world, but very much we like to work with civil society communities, but also with private sector. Blessy said very right. If the TB response doesn't take out the social inequities that we had and we still have in TB and other diseases, if we don't stop the stigma, and if we don't make sure that the rights of people are being addressed, we will never end TB or any other disease. A lot of our efforts are going into empower, and we are giving tens of millions of dollars every year as grants to civil society and communities organizations to enable them to do a lot of things, including demand creation, but to do another thing that is not very pleasant, is not very easy, but is needed, and that is accountability. In 2018, we had the UN high-level meeting, as we said, and there were commitments there. They are not achieved. Some a little bit achieved, but some good progress happened, but not yet there. There will come the 2023, and we need to have a very strong UN high-level meeting declaration with numeric targets. The people that will sign those declarations will be our heads of states and governments. Our heads of states and governments are signing declarations like the mayor, we say, like they don't even look. It can say that they will wear underwear that are pink and they will have wings and fly and they will sign, because few of them are reading what they sign, right? But accountability is what will make them focus and deliver for the people in the countries that they serve. And there is nobody else better in keeping accountable the heads of states and governments than the people that are affected by TB and other diseases, and by the people that are suffering and the civil society and communities. We are supporting them to develop, they developed this year a report called Deadly Divide, the deadly divide between North and South, between the promises and what was achieved, and even within the same country. Because we have a deadly division in what people can be diagnosed and treated for TB and other diseases between ourselves. And unfortunately, in the year 2023, we are still so different that me from Romania and living in Geneva have access to amazing tools, the latest ones that you, Blessy, and Atul and Teresa mentioned, while people in other places are still being diagnosed with smear microscopy and treated with long-term treatment. So I end here. My time expired, and I don't know if I will ever speak in this platform again, not that it counts too much, because I don't know how much of what I said will be actually happening. But my last plea is this. We can end TB. It's feasible, there are new tools, there is commitment, and the money are not an issue if we invest them smart. It just matters to want to end TB. And to want to end, for God's sake, a disease that was with us for hundreds of years and that we are unable to do it because we are always running after moving targets. Thank you very much.
Thank you, Luchika. Thank you, Luchika. As passionate as always, and as you rightly said, stigma and discrimination continues to kill people even today because they don't access care because of that. So thank you, and thank you to Stop TB Partnership as well for all their work. Now we'll move to listening a little bit, hearing from a regional perspective from the Euro region. I'd like to call Dr. Hans-Henry Kluge, who is the regional director of the Euro region. And Hans, Euro region has put in place many, many efforts to fast-track progress to end TB, especially in the middle of very difficult circumstances and the conflict in Ukraine and the trouble in the neighboring countries. So we'd like to hear from you about priorities of the Europe region, innovations that are led, and how are you addressing the needs of the vulnerable populations and the rollout of these innovations. Over to you, Hans.
Thank you very much, Blessy, and my big brother, Tedros, and everyone. Actually, I was thinking the fact that I didn't have the lunch and I have to speak after such an inspiring speech from Luchika, whether I'm a medical doctor, a physiater, an activist, or a policymaker. I guess maybe all. But I will try to share in a few points right from the European perspective. Actually, the last UN high-level meeting was about 5 years ago, and we were there with Dr. Teresa Kasayeva. We were working for many years together. And at that time, the European region was the best pupil in the class, the fastest decline in TB mortality, in TB incidence. But as you mentioned, Blessy, we have, a number of unprecedented challenges. We were the epicenter of the COVID-19. Maybe one of the reasons because we have such an aging population, which is living longer. And then indeed, we have a number of geopolitical challenges. While at the same time, we represent 22% of the global MDR-TB burden and 42% of the pre-XDR TB burden. But I was mentioning at the Polish mission with the Polish ambassador, Mr. Czech, right, the other day that somehow, like Luchika, I'm a born optimist. So I think that the glass anyway is half full. When I was treating as a clinician MDR-TB with Médecins Sans Frontières, for which I worked for 5 years in very difficult circumstances, it took 24 months treatment regimen, of which 8 months injections, and about 14,700 pills. If every day you have to put a painful injection in the butt of a child, it's like a torture. And now today, the treatment regimen is 6 months with about 700 pills. Of course, it's still too much, particularly if you're the breadwinner, but we sometimes forget to celebrate the huge advances in technologies. The same for diagnostics, digital DOT, and other ones. I would like very shortly touch upon two hopeful stories from the co-facilitators of the UN high-level meeting. One is Poland, when we were working very closely with the Minister of Health, Dr. Adam Niedzilski, on getting through the parliament the MDR-TB drugs registered. Because when the Ukrainian people were coming to Poland, these drugs were not registered yet. And this usually takes a long time, but this was done in record. So if there's a political will, there is a way. And then from Uzbekistan, the president himself is incredibly committed and set very ambitious annual targets. I got acquainted with the Minister of Health of Uzbekistan. He inspired me a lot. He told Hans, I was called by Mr. President, he told, from today, everyone in the Ministry of Health has to work 20 times more hard and more fast. I told Mr. Minister, once I'm back in Copenhagen, I know what to do. So this is very positive. Now, what are the challenges? Number one in our region is the price of the drugs, particularly as we have many middle-income countries, because they fall out of the boat of global mechanism, and they're not ready yet, their mechanisms, to be self-sustainable. So the price of the drugs is a big issue. And then number two, I heard it a number of times, but I want to repeat it, is we cannot overdo the collaboration with the civil society. If we really want to leave no one behind, it's really the patients, the NGO civil society. Because I worked on both sides, with WHO and also with MSF, Doctors Without Borders. If you really want to reach the unreached, you have to go for a partnership. There is no competition. Everyone has a certain comparative advantage. WHO has the normative, because when I was working in Myanmar, it was not possible to start MDR-TB treatment without national guidelines. That was the turf of WHO. But then you needed people to go, to the Rohingya population, to Rakhine, and there the NGOs were very, very important. With this, I would like to thank everyone for having the opportunity there. I must say I'm very inspired by everything that I heard, and probably the conclusion is, Lushika, that I remain an activist after all. Thank you.
Thank you very much, Hans. I do apologize. We are running short of time, so unfortunately, we perhaps can't take comments from the floor as DG needs to leave. But thank you so much, Dr. Tedros. We do have a few comments from the floor. The first one is from the International Federation of Medical Students Association. If you could kindly limit your comment to a minute if possible, and please go ahead. Thank you.
Thank you, Chair. As we look back on our TB-related SDG targets and our goals in the 2018 Political Declaration on TB, we should recognize the undeniable efforts and progress that we have achieved to end this epidemic. However, as youth, medical students, and future healthcare professionals, we believe more can be done. Therefore, owing to our global action points and indicators, I would limit my intervention to two calls of action to our member states. One, ensuring the meaningful engagement of all sectors of society, specifically in policy design, implementation, monitoring, and evaluation on the national level, through sharing of best practice of engagement between countries, supporting capacity development and health literacy initiatives, in addition to ensuring the clear representation of civil society in the national strategies to end TB. This includes youth and the importance of establishing platforms for their meaningful engagement, in addition to supporting and learning from existing successful ones, such as the WHO 1+1 Youth Initiative to end TB. Second, ensuring that TB-related targets are not negatively impacted by pandemics, conflicts, economic crises. This can be done with the inclusion of TB in all policies, including the non-health focused, for TB can only end through addressing its prevention and treatment targets while focusing on the social, economic, environmental, commercial, and political determinants of TB. The IFMSA welcomes all collaborations on ending TB and highlights the fact that future healthcare professionals, including but not limited to medical students, should be equal partners in the fight against TB through their education, empowerment, and meaningful engagement. TB can end, and we all must contribute to this through an evidence-based approach that ensures a world safe from TB. Thank you.
Thank you very much for that. And your comments are well noted, very valuable. Thank you very much. I'd like to now call on Kitty Van Wiesenberg, Director of Surveillance, Prevention and Control, Division of Antimicrobial Resistance. Please limit your comment to 1 minute. Thank you.
I will be very short, just to say that I feel among my family, I worked for 39 years in TB control. I know most of you. And I'm now working in AMR. What I want to share with you that I think your glass is half full. It's unbelievable what has been achieved in TB control. If you look at a newborn program like AMR, established only a few years ago, there is no surveillance network. There is no laboratory network that is coming with a representative data. We are not even close to involving, becoming integrated in primary healthcare, benefiting from UHC. Diagnosis and treatment in TB has always been free. In European countries that I recently visited, the cost of diagnosis is twice the cost of 2 courses of reserve drugs. So what do the doctors do? They prescribe the reserve drugs. In our program, we are learning from everything that has been achieved, setting up a people-centered framework for TB control, a global diagnostic initiative, treatment guidelines that are evidence-based. We are learning so much from you. We are also learning from the mistakes. Like, for instance, I think that we involved the private sector too late, and we should have done this before. I want to thank Teresa and everybody working in the TB department for the really strong collaboration, which is ongoing. And just one example is the joint research agenda, which has just gone through a huge global consultation. I wish you success during the HLM, and we will support you wherever we can. Thank you.
Thank you very much, Kitty. I think in your position with AMR, you will be able to push the TB agenda forward as well. Thank you very much. With that, we come to the end of our panel. And just to say that we as affected communities want to see cooperation, support, and commitments to work together, to push one collective agenda, to reduce suffering and save lives from TB that is possible. We as the affected community, people suffering with TB, need to be confident that our leaders are doing everything in their power, everything that is possible to make ending TB a reality for us. We need actions to back the words. With that, I'd like to hand over to Dr. Tedros for his closing remarks and thank the panels for this amazing inputs that you've given. Thank you very much.
Thank you so much, Blessina, our moderator of this session, and to all panelists. I think all have been said. I don't want to repeat. What matters now is, as Minister said, the political commitment. And the political commitment, of course, to drive the 4 priorities or concrete targets which we have already outlined. I started with those. I think all panelists also mentioned those targets, which is very, very important. It means we're on the same page. And we believe anything is possible. We have seen it in this pandemic, when a vaccine was produced or developed and, was ready for use in just under 1 year. For TB, there is already something in the pipeline, a TB vaccine that can work for adolescents and adults. And if we can invest a fraction of what we invested in the COVID pandemic, I think it can happen quickly. So the issue is, do we really want this to happen? If the answer is yes, then It can happen because it's in our hands. It's a matter of choice. And if it's our choice, it can be done. And to be honest, it's very embarrassing to live with such an ancient disease, but we know very well. And we have tools, and we can also produce more tools to stop it. So it's a matter of choice, and we need to make that choice, and we need to be more aggressive than we're doing now. And I hope the UN high-level meeting in September will open the doors. But between now and then, we have to do everything for this to succeed, for the targets to succeed. And Ambassador is here with us, and thank you for co-facilitating the high-level meeting. And please be assured that everybody here will support you, your colleagues in New York, and the President of the General Assembly, so that we can have a good outcome of that meeting. And we hope that high-level meeting will be a game changer in the fight against TB, and we achieve the 2030 target, hopefully ahead of it, but at least by 2030. Thank you so much. Again, Blessina, we appreciate the role of the civil society, and I hear you very clearly, our youth representative, for the 2 recommendations you have made, and we'll follow up on those 2 issues, and we will make that happen too. Thank you. Back to you, Chair. Thank you.
Thank you, everyone.